Karen, this is Michelle, and I'm doing the IV insertion skill. I would come into the room, explain my procedure to the patient, identify the patient, identify myself to the patient, tell them what I'm going to do. I would check the doctor's orders to see what I need to, what size of IV insertion I need to have. That's very important when you're inserting an IV or starting an IV, because it depends on the gauge and the type of product you're trying to infuse. So today I'm going to be giving blood, so I'm going to be using an 18 gauge for my skill. I have all my supplies here, and like I said, I checked the doctor's orders, and I'm going to use an 18 gauge. I'm also going to check for right-handed or left-handedness on the patient, and also if I was having problems finding the veins, I could have the patient clench their fist or lower their hand below their heart. Also, I could use warm packs, or I could gently tap the vein. That also would engorge the vein. Those are some different ways to get the vein to engorge. And since I'm get the vein to pop out so I can see where it's at, or what should be engorged. So since I'm giving blood, this is my hand here, my stimulated hand. And since I'm going to be giving blood, I don't want to be down here on the metacarpals. I want to be up here on the upper arm more, and this is going to be stimulating the upper arm. So I want to apply my tourniquet here. Make sure it's nice and snug. Okay, there's nice and snug. So I can see that I have a really good vein right here, and I want to avoid bifurcation, or right here where there's a little Y, obviously. And I want to have 2 finger lengths on the vein, and it pops back, so that means that's a good one. Sorry about that, that was a phone we didn't shut off. So we have 2 finger lengths, and it's popping back at me, which means it's a good vein. I don't have any valves or anything like that, or bifurcation. So I found my vein, so I'm going to let go of my tourniquet. And I'm going to activate my core prep. Okay. And then I'm going to clean the site all the way around it, and it's going to bleed a little bit here because I have marker. Clean all around it to make sure that if I don't get at one site, I might have to move around a little bit. But I want to make sure that that's clean. So now I'm going to open my packages and open my needle here. And the doctor wants me to start a saline lock, so here's my saline lock. Need a 2x2. And my tegaderm. And I'm going to, with my saline lock, I'm going to flush that. Okay, so then I'm going to go sterile to sterile here. Be sure not to touch the end. So, and then I'm going to loosen this end just a little bit here, so that when I'm ready to put it onto the IV, it's ready to go. I'm just going to push, there we go. Perfect. Okay, that there. I would also make sure not to touch that end to anything. That would break through it. But obviously you have the cap on it, so never mind. Okay, so I'm putting my gloves on here. And I'm going to move my hand down here a little bit so you can see a little bit better. I'm going to reapply my tourniquet. Nice and snug. Tricky on my can't here. Go. Okay. So now I think I'm ready here. And then when I'm inserting this, I want to make sure that it's on the hub right here, or not the hub, but the little clasp, if you will, so that I can just, when I get the needle in, I can insert it, or not insert the needle obviously, but I want to advance it as soon as I get it into the vein. Okay, so I have my thumb on here. I'm going to pull the skin taut because I want to make sure as much as I can that the vein doesn't roll. So I'm going to go and make sure that this does not touch my fingers or my gloves. So I'm going to go in at a 30-degree angle, and I have to hold it. So I'm going in, I got blood return. So then I'm going to kind of turn to the left there. And there it clicked. So now I want to stabilize, and I'm telling the patient to hold very still because I want to make sure that this doesn't go anywhere. This tape is sticky. It's just so tricky to try and work with. The patient is holding very still now because I want to make sure that now that I got it in there, I don't want it to move around. And this is not promising to be very easy. The patient is holding still for what we can say sake. So then I'm going to hold this here, right above, well, not right there, I'm going to hold it right there and right there. And then I'm going to take another piece of tape and put it right above there. And then holding it. Make sure this is on. Try and get it right above there. We go. And then I'm going to. So this is sterile until I take this off. So I want to have this right here. Take it off. Make sure that doesn't touch. And that's in. So now I'm going to flush, and I want to make sure that I have my 2x2 under there too. Because now I want to make sure that if I would have put that on there before I put the saline lock on there in case I had any blood, I didn't want to get it all over the patient. So then I'm going to flush my 2 milliliters, and I'm going to see if there's any, if the IV has gone bad, if there's any pain, if there's any bubbling, if there's any infiltration. I would see that. So then I'm going to take this away, take this off. Stabilize this right away. And now I would also have, even before I would have, after I inserted the needle and before I would have put the saline lock on there, I would have loosened my tourniquet because I don't want to have any complications from that. I would have done that right away, caught myself, so I would have redone it. Okay, so now the IV is inserted, it's flushed, it's good. I got it in on the first try, so I would, the patient is not complaining of any pain, so I'd make sure that the patient is safe, take off my gloves, wash my hands. I would make sure that I charted what size gauge needle I had, what I was using it for, blood products, if I hung any saline, if the patient complained of any pain, if there was any complications. And I would also, on my tegaderm, I would write my initials and the date that I inserted it, and I would do my normal procedure steps, make sure the patient's comfortable, make sure they have their call light in reach, make sure the bed is in lowest position. And like I said, when I would do my charting, I would chart the product, that if I had any saline that I hung or any other products that I had with the blood, and I obviously was doing blood today, so I would chart that. If I was also using a pump or if I was using gravity, and that's it.